The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD warriors. We are gathered here for the next episode of TMD Demystified, and I am Tony Urbanek. Today, we're going to have a practical discussion on why dentists don't want to treat TMD. I think that's how I had it listed here for the discussion, why dentists don't want to treat TMD. This is a two-part series because the next episode I do in a week will come out as why dentists should treat TMD, why you should want to treat TMD. But today we're just going to talk about the misconceptions, misunderstandings, and misinformation related to this topic. The majority of dentists, young and old, experienced and unexperienced, if you survey them, and I have, don't want anything to do with TMD, and it's a shame. But before we get into that, I do want to welcome everyone to a new year, 2023. Happy New Year. And look forward to another year of TMD Demystified and educating you, my colleagues, and others on what actually is going on with TMD, not the misinformation, but the actual facts about TMD. There is a lot of misinformation, and anyone who delves in this area or even thinks about this area acknowledges that, whether it be patient, providers, dentists, oral surgeons, PCPs, nurse practitioners. It is, at times they think it's a big black hole and everything goes in and nothing comes out. And that is not true. So today, welcome to 2023, and we're going to start out with this topic, which hopefully will be a practical discussion based on my experience, but also factual experience, which has been verified by our independent study through Middle Tennessee State University on what I've discovered regarding how TMD operates and why there are so many disparate symptoms, and why there is so much confusion, and why actually when you understand it, it's not a complicated problem. I necessarily wouldn't call it simple, but once you understand it, it is not a complicated problem. But the nature of the problem scares dentists who are the primary potential providers to treat TMD away. And specifically, the specific types of dentists that have access to TMD patients with these symptoms would be general dentists, oral and maxillofacial surgeons, and orthodontists, although that does not exclude any other type of dentist or dental specialty. Those three particular types are most prone to see, because of the volume of their practice and what they do, to have patients come in and give complaints which are related to TMD, symptoms of TMD. So let's go through this list that I created. It may not be a complete list, but I may have certainly forgot some things. But let's talk about the reasons that dentists think that they don't want to treat TMD. Number one is, I think these patients are crazy. And I've heard that multiple times. I've heard it from my dental colleagues. I've heard it from my medical colleagues. I've heard it from ENT doctors. And it is just not true. The patients with the symptoms of temporomandibular joint problems certainly at times are emotional, no doubt about that. You can imagine what it must feel like if you have not experienced any of these symptoms of TMD, to have multiple symptoms. Usually they come in multiples, not just one, although you can have a patient with just one of the symptoms that denies any other symptoms. But most of the patients have multiple symptoms. Most of those symptoms have something to do with pain, and some are not painful symptoms. But if you've had symptoms for multiple years, 5 years, 10 years, 20 years, 30 years, and you go from doctor to doctor and no one can explain it, let alone treat it and make those symptoms go away, you can imagine, just imagine how you as an individual would feel and how that would emotionally upset you, and how you then over a period of time would come across to family members and acquaintances, but especially additional providers that you go to and try to explain your symptoms and especially your frustration. In my opinion, now this is an opinion, I don't think that TMD patients with this diagnosis are any crazier than the standard population. Obviously, the standard population has some psychiatrically involved patients, no doubt about it. What's the percentage? I haven't researched it recently. It's a small percentage, actually. Everyone feels stress. Everyone is emotional, especially as we get more sophisticated in our society. We have a lot going on, which I'm not going to comment on, but I don't think that by my experience, it's treating thousands. I mean, I have personally treated in the past 8 years successfully over 4,000 temporomandibular joint patients non-surgically, and done a couple thousand more patients than that who have done consultations with me who have not proceeded with treatment with our non-surgical device and protocol. So, I mean, roughly, I could easily say in the past 7 or 8 years, I have done consultations with 6,000 patients. And my evaluation, my opinion is they're not any more crazy than any other subset of the population. They can be definitely more emotional, no doubt about it, but it has to do with the emotions associated with having inability to explain it. Practitioners can't explain it, and certainly providers can't make the symptoms go away and diminish. And that is what they're seeing. So let's just get this one out of the way. And I put it up there first because it came to mind first when I wrote out this list. TMD patients are not crazy. They're crazy with pain. I have had 2 documented patients of my own, one on video, who were so more than frustrated, depressed with these symptoms that they admitted that they had contemplated suicide. Now, that's not being crazy. That's just being absolutely depressed with the amount of pain and discomfort that no one has an answer to. So please look at these patients objectively, and don't try to put a spin on it that isn't there. They're not crazy, not any more crazy than the average male or female in the United States of America. All right, second is misconception that these are complicated patients. They're complicated patients. They have a disparate set of symptoms, and each of these symptoms seems to be non-connected. This is true. These symptoms on first blush, when you listen to them, don't appear to be connected. Now, I've talked on multiple other episodes of how these disparate symptoms, which I'll mention for the umpteenth time here, are absolutely connected, and all originate from inflammation within the temporomandibular joint. That is the common denominator. But the disparate symptoms, when the patient comes into the practitioner's office and spells out one or more of the following, and the practitioner says, I don't understand, these symptoms don't seem to be connected at all, because they do not understand, as I explained, how anatomically, physiologically, neurologically, all of these symptoms are connected and directly caused by inflammation within the temporomandibular joint. But the disparate symptoms are, and I'll reel them off again, frequent or recurring headaches, earaches, jaw pain, neck pain, upper back pain, tinnitus, ringing in the ears, subjective hearing loss, fullness in the ears, vertigo, upper shoulder and upper back pain, arm, hand, finger tingling and numbness, and various kinds of locking. And there are other secondary symptoms that are directly related, but I'm not going to comment on them now because I'm still researching a few of these. Those are the well-accepted symptoms of TMD. The least accepted one is arm, hand, finger tingling and numbness, but not only did I hear that enough where I had to figure that out, but I've explained it, and it's very obvious how that occurs when you understand how inflammation in the joint eventually creates muscle trismus, tightening of the muscles, not only of the face, but the neck and the shoulders, that can create arm, hand, finger tingling and numbness as the brachial plexus gets squeezed by the neck muscles, scalene muscles. This is simple anatomy, guys. Simple anatomy. Unfortunately, maybe not 1 in 100 dentists remember much about their gross anatomy and haven't been educated at all on cell biology, basically anatomy and inflammation. If you understand the basics of cell biology, then you understand the basics of inflammation. And fortunately, that's where I had an advantage by being educated not only in medicine, dentistry, but also cell biology and anatomy. These are complicated patients, and it is a very simple to understand when you understand the basics of it. So they're not complicated. It's a complicated problem. Again, it's not a complicated problem. You just don't understand. You haven't taken the course. You haven't listened about the anatomy, physiology of inflammation and its reaction to the damaging effects of the inflammation and what happens on that inflammation with causing muscle trismus. And also, we've discussed this so many times, but also tinnitus, subjective hearing loss, and vertigo. That all has to do with inflammation getting inside the middle ear. Inflammatory fluids, not necessarily cells, although that is a theory. It cannot be proven. It cannot be disproven. But inflammatory fluids actually have an highway access to the middle ear from the glenoid fossa through the petrotympanic fissure into the middle ear, causing tinnitus, subjective hearing loss, and vertigo. Again, explaining these disparate symptoms easily. And they come along with the painful symptoms, not in all cases. But so it's not a complicated problem when you see the simplicity of what's going on here. It's generally considered that any treatment for this is a complicated treatment. And so the average dentist, oral surgeon, orthodontist, he doesn't want to do things that are complicated. He wants to spend his time on the more productive things, both time-wise and financially, that he can do that are beneficial for himself and his patients. Can't blame him for that. But it is not true that treating TMD is a complicated problem. When you understand the cause, inflammation, and you understand by unloading the joint itself or joints themselves, unloading the joint long enough to allow the inflammation to decrease, then you will see decrease in symptoms. And when you continuously are able to unload the joint to the point where the inflammation stays down, stays limited, then the symptoms stay limited, go away. So that's why and how the Urbanek device and protocol works. It's the Urbanek device, whatever you want to call it, is nothing more than unloading the joint long enough, consistently enough to allow the inflammation to go away, and educating the patient how to use it, because it's a protocol 24/7 for the first 2 months, and then indefinitely nighttime after that. That isn't a complicated treatment plan. There's nothing complicated about it. The entire consultation and follow-up examinations and checks takes both myself and my associate, Dr. Urbina, in our practice. We spend no more than total, start to finish, when we finally give the patient a PRN to return if they have any further problems, 45 minutes or less. 45 minutes or less, including that includes the consultation. So it's not a long or complicated process, but you do have to follow the patients a little bit, make sure they're following the protocol, make sure they're developing diminishment of the symptoms appropriately, and you see the patient 2 or 3 times or less, because as I mentioned many times, once the patient feels that they are happy, they are fixed, they're not going to take the time to come back to the office. You can't call them up, you can't bring them back, you can't cajole them to come back. No, I'm fine. Unless then they quit wearing the device after a while, or they break the device, then they'll be back in the office because the symptoms will recur. Does that sound like a complicated problem? It isn't. It is not. 30 to 45 minutes of your time total to treat a patient with temporomandibular joint problem. Certainly not complicated. It is not a complicated treatment at all. Lack of knowledge. Well, that's a true statement. The average dentist does not have the knowledge necessary just off the shelf to treat TMD, because it's not taught in dental school. The only thing that's taught in dental school about TMD that it is a complicated problem, and that the joint itself is a very complicated joint. In fact, so complicated you probably won't figure it out, both to the joint itself and to the problem itself. And that is basically what is taught in dental schools. There are a few dental schools which I will leave unnamed. There are slowly increasing that actually have facial pain programs or temporomandibular joint programs that are affiliated with larger teaching institutions, hospitals, and medical schools, along with the dental school, that want to make this complicated and get, complicated radiology examinations involves MRIs and CT scans, which are not necessary. Bringing consultations with psychologists and psychiatrists, thinking that by decreasing the stress on a patient, that you will decrease the amount of bruxism, and get involved with all that and the expense and the time. And by the way, we do not understand bruxism. It's all that what is known about bruxism is that patients under stress have a tendency to brux more. Those that do brux, half the population bruxes. But to treat TMD by using psychiatric methods or psychologic methods, or certainly psychiatric medication, which is becoming more and more popular, but not effective, and certainly doesn't stop people from bruxing. We do not have the answer to bruxing. We do not understand the mechanism that goes on within the central nervous system, especially in the brainstem, what goes on in there that actually creates people to brux. All we know is the more stress, the more people tend to brux, and that's about it. That's all we really know. The rest of it's theory. And I challenge anyone to actually prove anything that they say that they can stop people bruxing. It doesn't happen. So let's get off of that. But lack of knowledge. In previous episodes, multiple previous episodes that you can look back on, I explained thoroughly how this all came to be, what I discovered, which surprised me, that I was able to see it so simply, and that it was simple, and that why anyone hadn't determined this or actually looked at the anatomy and cell biology and neuroanatomy of the scene and compared it with other similar kinds of problems like tennis elbow. I have an episode on tennis elbow, and TMD fully explains what's going on with this problem. So lack of knowledge, and to gain the knowledge, frankly, anyone who will take the time to sit down and listen to the list of episodes in this podcast will sooner or later have the cognition that they understand TMD and can go on and treat it. Lack of time, we talked about that, we have a lack of time. Treating TMD just takes so long. I mean, you're going to have the patient in constantly in your practice, and you're going to sit down with them and listen to their symptoms for so long, and it's going to take hours and hours and hours. As I already said, once you catch on and you learn how to do this and you understand the pathology, the actual pathology involved, you'll devote total start to finish no more than 45 minutes per patient from consultation to PRN, unless they come back with a broken device or lost device, or they haven't used it properly, those kinds of things. And the last one, I was a little hesitant about putting it down here, but I think we need to have a practical discussion about this, and that treating TMD does not pay well. That's not true either. That's a misconception. That's misinformation. Once you know how to treat it, to get the results, that is, the patients are happy, the symptoms have resolved consistently, persistently, that it does pay well. The average, as I've looked into this, fee for non-surgical TMD treatment with a non-surgical device, any kind, throughout the United States is $2,000 to $3,000. And in our case, the Urbanek Device and protocol, of course, our doctors in our network can charge whatever they want. I know the fees are higher on the East and West Coast. I have heard such and been appraised of such. In the flyover America, of which Nashville, Tennessee is in the middle of, our fees are less. But the issue is the doctor can charge whatever he wants. But in our case, because it is a medical device without a CPT code, and we've actually years ago tried to get a CPT code, but was denied. It is a medical device without a CPT code and therefore fee for service. So it's very comparable to time invested to what the specialist or generalist would spend, and his remuneration would result from the general dentist making crowns, or the oral surgeon doing wisdom teeth, or the orthodontist doing orthodontic treatment, as far as time invested over remuneration. So it is not true. It does pay well. It is a practice builder. We were not going to talk about why you should do this. We're going to talk about other misconceptions. But we need to get away from the practices and the centers that make a complicated mess out of this. And I don't want to challenge anyone regarding the validity of what they do. If you get the results, go for it. Good for you. But if there's a simpler way, if there's a less expensive way, if you can get from A to B without a lot of x-rays and a lot of additional ancillary consultations and a lot of hours and work for both the doctors and the patients and the medical center, then why wouldn't you want to do it that way? Again, very pragmatic, very practical discussion about this. So we want to get away from especially there are practices that I'm well aware of that will definitely go unnamed throughout the country, and in a couple here in Middle Tennessee that basically are attempting to present this to insurance companies in light that in a light that gains them the most insurance return, by making it complicated, adding x-rays, adding extra steps, adding extra services, and that is not appropriate. And I don't want to get into a deep discussion about insurance issues in our culture, in our country. There's a lot of problems, as we all know, but as far as the simplicity of it is, and what I've explained to you, because it is a medical, literally, our device and protocol is a medical device because its only effect is on the joint itself, has nothing to do with the teeth, any effect inside the oral cavity, and it is a device that only treats the joint. When I did 30 years and 2,000 temporomandibular joint surgeries, it was always, if covered at all, was covered under medical. You can't call it dental now. It is not a dental service. It is a medical service that is fee for service. So, and the last one I threw out there was doctors who say, I don't see TMD. I don't see any TMD patients. It isn't that I see them and don't want anything to do with them, which is absolutely true. I have a colleague of mine who shared with me his experience. He's a well-known in the highest levels of politics within dentistry and clinical treatment within dentistry in the highest levels, knows everybody. And he is an orthodontist, and basically told me that when he was in his training, and he was trained by one of the icons in orthodontics in the United States of America in the earlier days, and his mentor, his professor, told him, when he said, what should I do about TMD? What's the best way to treat TMD? His mentor said, send him elsewhere. That has been the consensus for the past 50 years from almost all of our colleagues. It's not appropriate. It's not fair for our patients. It is not true at all. And then there are those that they say, I don't see TMD. Well, you're not looking, because it is a huge problem. 45% of females have temporomandibular joint symptoms. Inflammation within these joints are extremely common, whether it be due to functional malocclusion, bruxism, or acute trauma. Extremely prominent in females, less prominent in males for sure. But if you have 10 females in the room and list out those symptoms, I promise you that at least 4 to 5 out of 10 will raise their hand and say, yes, I have one or more of these symptoms currently. It's a huge problem. So why wouldn't you want to treat TMD? Well, that's what we're going to talk about next time. This time, we're just going to go through the misinformation and misconceptions about treating TMD. And I hope this helped you. I hope, some of it may not have been palatable to some of you who have, treated patients ineffectively, or not wanted to treat patients when you really should have. Okay, I'll take criticism for that. If you want to make comments, I'll take them. But I encourage you to learn more. I encourage you to listen to more of or others of our podcast episodes, because I explain it to you for the benefit of you and the patients, because you can make it an integral part of your practice, which is highly successful for you, your practice, and certainly your patients who have suffered for way too long with these symptoms, covered in many other places in these episodes. So for today, I'll wrap it up by saying again, Happy New Year. I hope you have a successful and effective New Year in your practice with your family, and hopefully that you will consider joining our network of providers, orthodontists, oral surgeons, and general dentists who use our device and protocol effectively for their benefit, the patient's benefit. Any comments, criticisms, you can send them directly to me or post them on this podcast if you'd like. But my email address is tony@tmjservices.net. If you would like to learn more or schedule a lunch and learn with our director of marketing or and education, you can contact Naomi at tmjservices.net. If you want to get a little deeper without contacting anybody, you can pull up our website and see more about our device and protocol, our practice, and how we have a long history now of helping patients with this problem, which is www.tmjservices.net. So for today, thanks for your attention. I look forward to speaking with you in a week. And now I've announced what we'll be talking about as to why you, the practitioners, want to and should want to treat TMD. Thanks very much.